Hi guys, my name's Mariah. I'm a nursing student. This is my PowerPoint for management. So the issue that I chose to research and speak on is essentially like burnout in the ER. Uh, as I think most of us know at this point, ER nurses are at a very high risk of burnout. So I thought that it was a good area to look into. So I titled mine Emergency of Compassion Fatigue to kind of tie in like the specialty and then the issue. So my objectives are to ensure that by the end of this slideshow, my audience is able to demonstrate knowledge on what is expected of the care that ER nurses provide. So, what is the quality of their care supposed to be like? Um, is it up to the standard of care? Uh, and the different variables that can cause burnout in ER nurses. Um, Knowledge of barriers that nurses face when it comes to providing safe patient care. Knowledge of ways that nurses, leaders, and legislature can improve the conditions of which patient care is being delivered. So focusing on like the environment and equipment and things like that. Um, and then lastly, I want my audience to be able to demonstrate knowledge of the risks that nursing burnout imposes on not only healthcare staff, but the population that is receiving care. And as we go on, I found quite a bit of really good research that uh, further backs up these points. So, okay, so the complex problem that I'm addressing. Emergency room nurses are faced with high retention rate due to many stress-inducing factors. Some of these factors include lack of staff, unsafe nurse-to-patient ratios, not getting support from leadership, patients demanding things, not having enough supplies, and working long hours. Nurses also face lack of self-care and often unsafe work environments. And I just want to point out too that a lot of the research that I found pertains to ER nursing, but also a lot of it is just nursing in general because every specialty in nursing is kind of facing these issues. Um, but I really wanted to hone in on ER nurses because they, as you'll see as we go on, they face like really specific complex issues. So my position statement. Nurses are an essential backbone within the healthcare system. As most of us know, the majority of care that is delivered to patients comes directly from the nurse. When a person, their friend, or their family member is faced with an emergency, it is often the ER nurse who first acknowledges the problem and makes a difference. Nurses are expected to deliver care in a manner that is professional and compassionate. However, current laws stigmatizations about nurses do not support the belief that they should be well compensated and provided with safe working environments. Nurses are often underpaid, overworked, and faced with situations that are unethical and dangerous. This issue has been ongoing, and nurses have been advocating for themselves in relation to the shortages via protests and strikes because when they are speaking up for help, they're not being heard. So my implications of 5 safety and quality issues. I want to preface this by saying there's way more than just 5 safety and quality issues when it comes to this issue. Uh, it's such a broad issue that it simply cannot be summarized in 5 issues. But some of the main ones that I found: nurses are working extended long hours with little to no relief. It's a common trigger in compassion fatigue. So often we work 12, 13-hour shifts. If the next person doesn't show up for their shift, it can sometimes be even longer than that. And if we're short-staffed, or if we don't have, if our hands are tied up with a patient who, or multiple patients who aren't stable, then we can't just leave and take a break. So working 12 to 13 hours, if not longer, without a break is very detrimental on our mental health. And then compassion fatigue can be extremely hazardous in the workplace due to the fact that it makes it nearly impossible for RNs to have empathy for their patients. So when a nurse is working without empathy, they're really like, what is their care being driven by at that point? I think in nursing, we kind of use our empathy as a way to guide the care that we provide. And without that, there really is no guidance, and we're losing a lot of the purpose in what we do, which is not safe. And then number 3, I said a lack of empathy in nurses results in an overall dissatisfaction in patients related to their care. So, yeah, we have all, I think most of us have seen this firsthand. Patients or their family members are not satisfied with their care when their nurse just walks into their room and doesn't conversate with them, doesn't listen to them, kind of just pushes through and is just there to get the job done and over with. So a lot of the time too, the people that are in need of our care, uh, they need that empathy, and they need someone to be there for them. So, number 4, a lack of nurses leads to longer waiting times in the ER. So I did not know this. This is new research to me. ERs will gather the assessment data at the bedside instead of doing the proper triage to make it go faster, to get patients into rooms faster. And the issue with this is that it can result in incorrect assignment of triage codes, which hinders patient outcomes because we're not providing care in the order that it's meant to be provided in when we're in the ER. So we have our different colors that we go by. We tag them as emergent or so on and so forth. So if they're not being triaged correctly, then we face a lot of issues. And then number 5, I said, studies show that for every additional patient a nurse takes on, the patient's mortality rate or risk for mortality increases by 7%. So that's actually crazy when you think about it, and a huge safety issue. So, yeah. And knowing that, like, as nurses, knowing that, I think that it really creates a lot of ethical conflict within us because most of us, I hope I can say this, most of us want um, our patients to get well. And, like that's kind of what drives us to be nurses. So when we are trying to do our jobs, but at the same time creating health hazards for them and ourselves, it's a bit of it could create some conflict there. So, okay. So, so here's a little bit, I think this slide and the next slide will talk about some of the research that I was able to find. Um, so Enns and Sawatsky, I hope I'm pronouncing that correctly, performed a study where they interviewed nurses from multiple disciplines on different variables that impede their ability to deliver empathetic patient care. So these variables included workload, lack of time, staffing issues, and lack of support from leadership, working shift work. So shift work would be like working your night shift, day shift, which is pretty typical for most hospitals. Um, and a lack of self-care. So these were things that the nurses reported, and yeah, I think that a lot of these are variables that could be changed if they were taken a little bit more seriously by people that are in control. Um, and then I really liked this quote. I think this draws a lot of attention to the issue. So, an RN named Anna Valdez wrote, quote, I have been an ER nurse for over 20 years. In that time, I have witnessed countless heartbreaking events. In that time, I was expected to be fine and move on, end quote. She writes, quote, I did not always know how to care for myself, and there was no system in place to identify that I needed help to address compassion fatigue and burnout. Patients and nursing leaders expect emergency nurses to be a limitless fountain of empathy and compassion as they navigate through some of the most challenging situations one can imagine. End quote. So I really like that because that is like kind of the whole reason why I chose this topic. ER nurses do see a lot. You never know what you're gonna see. You see patients losing family members, and when you think about it in the ER, when like something emergent happens, you are the first person, aside from the EMTs, that they're gonna go to and expect you to kind of like be their helper, which is an incredible job. It's one of the best jobs in the world, but we have to be able to take care of ourselves so that we can um, continue to feel that way about the profession that we chose to go into in the first place. Um, and then, so some more evidence that I found um, demonstrated that nurses reported that they are hesitant to seek out mental health care due to fear of employers questioning their stability and ability to provide care for patients. Um, so, so yeah, this is a huge issue. Um, And it's just kind of silly to uh, disregard the fact that nurses are human and they do have emotional needs. Um, yeah, they are emotionally impacted by their work. Um, and then lately in the pandemic, especially, we have really, um, like, this has really become an issue, referencing nurses um, as frontline heroes, um, further further extends the belief that nurses need to be resilient, and it reinforces the unspoken message that nurses do need help managing their mental health. So, yeah, I kind of like dehumanizes nurses a little bit. And we want to be heroes, but at the same time, like, we need to have support and be able to take care of ourselves. Our mental health needs to be addressed as well as our physical health. Um, okay, and then a little bit more research that I found. So, according to the International Council of Nurses, reports demonstrate a trend that nurses are underpaid for their services. The reports note that the nursing profession is predominantly female, and caring professions are often written off as women's work, therefore allowing nurses to be undervalued and underpaid. Yes, I actually was so happy to be able to find this research because it's very true. A lot of the time, like, people want to say we should be nurses. And I do agree with this. We should be nurses because we care, but at the same time, like, nursing is a job and it's a really hard job. Um, and women are just expected to provide compassionate care because we are natural caregivers, but it is a job, and in nursing, your time is money, and you deserve to be compensated for the hours that you spend on your feet, taking care of your patients. So, if you take anything away from that, whoever's watching this, know your value and don't let people take advantage of you. Yeah. And then lastly, Streamline Verify ranked healthcare as one of 3 professions with the highest turnover rates. These findings demonstrate that newly licensed RNs who work in hospitals leave their job within 3 years. 33.5% resigned after 2 years, and 17.5% resigned after only 1 year. So, yeah, that's crazy. It makes a lot of sense as to why there's a nursing shortage when you look at those statistics. Social and healthcare policy implications. So these numbers that I found are pretty alarming. According to the 2019 National Healthcare Retention and RN Staffing Report, the average cost per facility due to RN retention is $4.4 to $6.9 million per year, which is a lot of money. And then each percentage of RNs that leave their staff job can result in the hospital losing $328,400. So, for every 1% of RNs that leave their staff job, that's pretty, that's so much money. Um, and then that same report also notes the amount of time it takes to fill a staffing position. So for an RN who doesn't specialize uh, in something like NICU or something like that, It takes 85 days, and then for an RN who does specialize in more special areas of the hospital, takes 3 months or more. And then this costs the institution about $82,000. So that amount of money does not take into consideration how much goes into paying the RNs to work overtime to fill the absence of the staff. So, yeah, it's a huge financial implication. Uh, Staff retention is costing a lot of money. So, my solution, did, oh, excuse me. I did my assessment in the nursing process format. So, my assessment is that RNs are resigning from the profession due to burnout, poor financial compensation, and poor communication. Um, and that comes directly from research by Drew and Hammond. And then my diagnosis is that there is a worldwide shortage of RNs, or in this case, specifically ERNs, but like I said, it applies to all disciplines. So, and then my plan is to discover ways that voluntary RN turnover can be minimized. So I want to find out how we can increase job satisfaction, basically. Like, if nurses are satisfied with their jobs, they're not gonna, well, as many of them aren't going to be leaving intentionally. And then my implementation. So, I found in research, studies suggest that senior leaders can use effective communication and listening skills to address the concerns of nurses. And these concerns include respect, competitive financial compensation, benefits, and proper recognition. And then my evaluation. So, how are we going to know that this is going to work? Well, has this improved ER RN turnover rates? Are hospitals being staffed appropriately? If not, then more research needs to be done to discover why are they leaving the profession that they once desired. So we go through nursing school. Nursing school is hard, it's expensive, and you have to make a lot of sacrifices to get through nursing school. And I think everyone's end goal is to have that job that we all want so badly. So yeah, as a nursing student, like, it is a little bit discouraging to see that our senior RNs, the people who would be teaching us the skills that we need, are leaving the profession because at some point they have decided that it's not worth uh, it's not worth it. So hopefully our generation, we can see some improvements, and we can continue to advocate for our profession, for ourselves, our patients. And yeah, I have a lot of faith in our generation of nurses coming up. So, okay, so resources that would be needed to further improve the issue that is ER nurse shortages. So, uh, I think that it would be effective for us to write a proposal to Congress, uh, suggesting minimum staffing mandate laws across the U.S. to eradicate the unsafe nurse-patient ratios. Nurses across the U.S. can protest to advocate for their profession with the support of their leaders to gain awareness on the issue. Excuse me. Uh, and then we would also need some data collection for this. So we we could use the data that is available in the research that demonstrates the harm that the shortage of nurses has caused. But I think that it would even be more effective to take this a step further and go out and collect our own data. We could do that by um, going to our quality management and looking at like their data collection for things like med errors and uh, like falls and stuff like that that have happened when nurses have had more than the safe amount of patients. So we could also provide a questionnaire to our RNs, and it could be an anonymous questionnaire, of course, so that they could report any incidents that they have experienced uh, due to having a patient assignment that is heavier than what they're capable of safely handling. And then I also think that educational seminars would be beneficial. Um, so I nurse leaders could attend these seminars to expand their education on ways to be more effective leaders. It would be beneficial for our leaders and us to suggest this to the hospital. They could pay for the nurses to attend these, and then we could see uh, if that was beneficial, if that helped at all. And then, yeah, our quality management, we would need, like I said, to gather our data. Budgeting. So, um, we could suggest to our hospital executives that the budget data is revised to observe what the biggest financial costs are and what can be done to cut back on those costs and allow nurses' wages to increase. So not only that, but like I said, we need to find a way to fund uh, these educational seminars. Um, yeah, I think that I'm not really sure where a lot of the hospital money goes, but I know that it doesn't go to the nurses. So if you think about it, I mean, making 25 to $35 an hour really compared to how much money the hospital actually takes in is really not that much money. It also depends on like how big your hospital is, but yeah, this would be specific to the hospital. And then I think that a weekly questionnaire would be beneficial so that we could observe how the nurses are doing emotionally. And then if they make sure that like they're in a emotional state that is safe to ask them to pick up extra shifts or to take on an extra patient. So I don't know why we don't do this already. Like there is such a lack of consideration for mental health in nurses. that it's actually really sad and disheartening. It, yeah, yeah. So, and then lastly, extra security and screening among admission to protect staff. So, example, check patients' belongings before they're brought into rooms. I know that like hospitals, I think in Traverse City there is a security screening that's just like when you walk into like the courthouse, like you put your bag through the scanner, they scan you. I don't know why we don't do that at hospitals. Uh, it really actually kind of blows my mind that we don't do that. I don't know, but there needs to be more attention drawn to the safety of our nurses. Not only our nurses, but like everyone that's working in the hospital and our patients as well. So that, yeah, that's a pretty big issue, I think. And then, so us, we're graduating hopefully in December this year, which we're so close, guys. We are so close. So how can entry-level nurses play a role? We can provide information to our leaders regarding the main issues that impact the environment of which the RN provides care. So we need to speak up, basically. When we see issues, when we experience them, we need to gather our data and let the leaders and the managers know. And kind of what I said in the beginning, advocate for yourself and your patient and know your worth. Don't settle for a job that you know you're not going to feel satisfied in, because that's just going to further push retention rates. A few slides back, we saw how high the rate for nurses to leave the profession within the first 3 years is. So we really need to be our own biggest advocate and make sure that we're going into a job, we're going to job interviews, we're asking the questions like, what are your nurse patient ratios? What are your benefits? What are your breaks like? What is the job satisfaction among your RNs? And then take care of yourself. So we need to take mental health days. We need to be able to say no. It is okay to say no if you are not in a mindset to work an extra shift, or you're just exhausted, or even if you just don't want to because you know it's healthier for you to not do that, it is okay for you to say no to picking up a shift or no to taking on another patient because you know it's not safe. Also, still on the taking care of yourself, get mental health support, get a therapist before you're to the point where you're like not happy. Uh, yeah, just take care of yourself, meet your own needs so that you can meet others as well. And then we can also attend protests. So lately in New York City, there was very large protests because nurses were being underpaid, and there was just a huge, huge shortage. So, and it was successful. Those nurses were able to get their wages increased and start getting compensated for their work. And then, like I said, in our materials, we write letters to Congress. Um, we can attend the seminars regarding the shortage of nurses, so we can educate ourselves. Um, yeah, stay educated, understand the safety risks that you're taking when you are taking on an extra assignment or an extra patient. And then refuse to take on excessive workloads that hinder the safety of you and your patient, of course. And yeah, and then this one kind of goes into ties into advocating for yourself. So research the hospital of which you will be applying to prior to your interview. Ask questions regarding the work environment and management. So yeah, ask what are your values? What do your leaders value? What kind of leadership style do your leaders uh, approach the nurses with? Uh, yeah, and I think that there's right now as students even we can attend seminars for things like that. So yeah, education is power. If you take anything away from this slideshow today, I hope that you take away you are your patient's biggest advocate. So advocacy, you know better than anyone else what your limits are and what is safe for you. And also education is power. People cannot take your education away from you. Uh, so stay educated. Okay, so my nursing philosophy, uh, my individual philosophy on nursing prioritizes the nurse's role in delivering patient care. The RN is expected to deliver care that is ethical, compassionate, safe, and within reason. The current retention rate and the causes of retention among ER nurses contradicts the ability to fulfill these expectations. This directly correlates with the meta-paradigm of nursing practice, which states that nursing as a profession is guided by the art and science of holistic care. The values of which this care is guided by include choice, freedom, empathy, concern, responsibility, and commitment to the patient's lived experience of human health. Human care is the center of nursing, and it is what makes nursing a profession. This has been applied throughout this presentation because patients, the centers of our care, are directly impacted by the lack of justice for our nursing profession. And then here is a list of my references that I use throughout this show, the slideshow presentation. So, like I said, there's a ton of research. I actually was a bit overwhelmed by how much research was available on this. So, yeah, I hope that this was effective in one way or another. And yeah, I'm excited for all of us and the nurses that we're going to become and the change that our generation of nurses is going to bring to the profession. I hope that it's for the better because there definitely needs to be a change. That, yeah, I'm excited, guys. We have one semester left, so we're so close, and we are, I'm so proud of all of us for how far we have come. And I'm excited to see where the future takes all of us. So, and yeah, some of us are going to go on to become ER nurses and other specialties like the ICU even have such high rates for burnout. So This is a really, really important topic. I've worked in healthcare for 8 years now, and I've experienced compassion fatigue and burnout, unfortunately. And I've gotten to the point where I have learned how important it is to advocate for yourself and be able to say no, and be able to take those self-care days so that you truly can take the extra few minutes to really listen to the person you're taking care of, um, to really make them feel like you care about them, because that's so important in nursing. All right, guys. Well, I really appreciate you for listening if you listened to this whole thing. Um, my presentation skills, uh, they're a little not super strong, but we're working on it. So, yeah, I learned a lot from this assignment, and I hope you all did as well. Thank you. Bye.